There are a lot of things that only NaPro technology doctors and surgeons can do, but today I'm talking about one of my most favorite things ever. Now, not everyone needs surgery, but for those that do, the NaPro surgeons are some of the most careful and precise that you'll find, and it's because of their unique training, because of the research of Dr. Hilgers that no other type of surgeons do. And I know this firsthand because I've had surgery by both a mainstream gynecology surgeon and NaPro technology surgeons. A part of this very unique training is something they call adhesion-free or near adhesion-free surgery techniques for people with pelvic adhesive disease due to endometriosis and or pelvic inflammatory disease. That's just a fancy word for people who have a lot of inflammation and problems in their pelvis that give them pain. Now, this is not what people want to hear, but endometriosis is a surgical disease. Many gynecological surgeons avoid this for 3 reasons. A, they just tend to give birth control as a treatment. However, there's no research to indicate that the birth control is actually slowing the progression of the endometriosis. It just kind of gets rid of the symptoms so you're not feeling that, but the endometriosis is still there. B, IVF. With the progression of IVF services, this type of surgery has been kind of de-emphasized. But again, with IVF, the problems or issues that are preventing the woman from getting pregnant are not being addressed. So that's bypassing those issues. Those issues are still there. And then C, another reason many gynecological surgeons avoid this is because surgery itself forms a lot of adhesions or scar tissue. Now, scar tissue forms with any type of surgery that we have. I know this in working as a physical therapist assistant before we had Bella come into our lives, our adopted daughter, where I would treat a lot of post-op patients after shoulder surgeries, knee surgeries, hip surgeries, anything. And a big problem we would have post-surgery was the interference of scar tissue with range of motion. So we would often be stretching the joints to get through the scar tissue to give a patient range of motion again. When you have surgery in your pelvis, it's no different. It's just not a joint. So the consequences of those surgeries are a little bit different. And 55 to 100% of women develop scar tissue as a result of pelvic surgery. So it's just a fact of life. It's not something that we can avoid, that scar tissue just wants to happen with surgery. So some possible consequences that we can have when we have surgery in our pelvis due to scar tissue are subfertility or infertility, small bowel obstruction or injury, chronic pelvic pain, pain with intercourse, just to give you some examples. So it's almost like the scar tissue itself is a disease in addition to the disease the surgery is trying to fix. But NaPro technology founder Dr. Hilgers spent over 23 years of research to develop a plan for these surgeries to reduce the amount of scar tissue that forms. So I have right here the research from this study that took over 23 years. So for his study, he chose to evaluate patients with the most extensive pelvic adhesions due to late-stage endometriosis and or pelvic inflammatory disease. So each patient underwent a preoperative diagnostic laparoscopy. So first, what that is it's a little minimal surgery with just 2 holes, one in the belly button and one a few inches below, where he goes in and he just looks. He doesn't fix or do anything. He's just looking around to see what the issues are. So they had that. And then each patient in the study also had another surgery. This time was a laparotomy. For those of you who don't know what a laparotomy is, it's when you have a C-section scar. So it's a scar that kind of gives you a smiley face down there. And it's a much bigger surgery. It's a major surgery where he would actually go in, lysis the adhesions is what they call it. It's just another form of getting rid of any adhesions that are there. He would also remove any endometriosis if that's present, and a reconstruction of the pelvis on the inside. Then, about 10 days later, there would be a 3rd surgery. This one, again, a minimal surgery with 2 holes in the belly button and just a little bit below to either get rid of the adhesions that had formed or remove a mechanical barrier, which I'll explain in a minute. The reason he picked 10 days after that major laparotomy surgery is because most scar tissue forms within the first 10 or so days of surgery. So he used 3 different phases of anti-adhesion techniques in these surgeries. Each phase includes the techniques from the phase before in addition to something new. He then compared each phase to each other. He did this by using scores of adhesions. Scoring of adhesions was done according to the American Fertility Society system of adhesions. Yes, they have a society like that that scores adhesions, but at least it gives something standardized that he measured. All right, so here's where it gets awesome. The conclusions of these studies. With the anti-adhesion or anti-scar tissue techniques that he used in phase 1, the total adhesion scores decreased from almost 34 to just 18. That's a difference of 16 points just in phase 1. In phase 2, it decreased from 33 to 6. That's a difference of 27 points. And in phase 3, where he used all the techniques from phase 1 and phase 2, so phase 3 had the most techniques of all, it dropped from 33 to only 2.5. That's almost nothing. And it's a difference of 30.5. So as you can see, the research is pretty astounding that he could decrease scar tissue that much. So just to give you a little idea of what these phases entail, because I think it's very interesting and it makes sense to know these things, I'll give you a little bit of my experience afterwards because I've had this surgery done. These multiple surgeries done. So in phase 1, I'm gonna read to you kind of how he explains it, but it's basically what seems to be most important is taking more time to pay attention to the details to reduce scar tissue. So he describes it as, at the present time, the best approach to the prevention of pelvic adhesions includes attention to surgical detail, adherence to microsurgical techniques, and principles such as gentle, non-crushing tissue handling, creating and maintaining a continuous humidified peritoneal environment, as well as judicious and meticulous use of energy sources. So we're talking about being very careful about the actual instruments that he's using. You're taking time to do things like intermittent irrigation, getting rid of blood that's just sitting in the body that can form scar tissue. Any trauma can form scar tissue within the body. Suture selection. A lot of these are just like fancy doctor words that I don't understand, but you can just tell that it's just paying very careful attention to detail, which takes more time. Techniques used for closing surfaces. He talks about like if a surface that they cut through is jagged edge, that causes scar tissue. So what they're gonna do is that fold it over and suture it down like that, so scar tissue is less likely to form. And I think that a big difference between NaPro technology surgeons and mainstream gynecology is time spent. And that goes in doctor visits, but also in surgery. And what I mean by that is when you go see your gynecologist, you're not spending a whole lot of time in the office. It's basically a little conversation. They offer birth control. You know, if you have any other issues, you might talk about that if you have questions. But when you go to your NaPro technology doctor, they're spending a lot more time with you. Actually, they can see fewer patients because they're giving so much time to their patients. It's the same in surgery. I know this because the surgery I've had with a mainstream gynecologist only lasts about an hour and a half for this type of surgery, and they just do one. And it's just lysis of adhesions is what they call it. And typically, in my experience of talking to other people, it lasts about an hour and a half. Well, your surgery with a NaPro technology doctor is gonna last longer than that because they're taking so much time. Okay, so that's phase 1. Phase 2, I think, is really interesting too. So in phase 2, they add something called lap packs. I think it's just a pack of fluid or filled with plastic. I don't know what it is. It's just some type of barrier that they put into your body to kind of pack the bowel away, because the bowel, everything is really tight in there. And the bowel, if it's too close to everything, it can get nicked, which causes scar tissue. It can cause other problems. And then the bowel can then attach to the other organs. So what he does is he packs the bowel back with these lap packs, okay? In addition to everything he did in phase 1. And then on top of that, this is gonna sound crazy, but it's really cool. He created something called an adhesion barrier, or Gore-Tex is what they call it. They wrap your organs, like uterus, fallopian tube, ovaries, kind of like a blanket in this Gore-Tex. I know it sounds crazy, but the importance of it is that it's this very special material. It just got really windy. I hope you can hear me. That scar tissue doesn't really stick to. 10 days later in that other surgery, that's the mechanical barrier I was talking about that they remove. So when I remove that, the scar tissue comes with it. Or if scar tissue was attached to it, they would remove the scar tissue at that time. But it's basically protecting those organs. So the scar tissue forms or doesn't form to that Gore-Tex, rather than causing further damage to those very important organs that we have inside of us as women. So I know y'all are thinking that this is crazy to have 2 surgeries in such a short amount of time. I'm gonna read to you what Dr. Hilgers says about this. While this type of placement does require a second look laparoscopy for the removal of the Gore-Tex, the results are so dramatically good in terms of adhesion prevention that it becomes rightfully justifiable. At the same time, it has been clinically observed that the second look laparoscopy is well tolerated by this group of patients and does not appear to significantly delay their overall recuperation from the initial injury. And I can speak about this firsthand because I've actually multiple times had this series of surgeries, and it's the truth. I've healed very quickly from them. I've not found it to be, I mean, in the sense that you have to have another surgery. Yes, nobody wants to have surgery, but it's been so worth it because, like I said, everybody forms scar tissue. People form scar tissue at different rates. Some people form less scar tissue than others. Like I said, I noticed that as being a therapist when I would stretch people. I personally know from experience of surgery that I form a lot of scar tissue. So I've been really grateful to have that adhesion barrier and all these other things that they put in place, even if it means I have to have another surgery, because I know how significantly it's going to decrease the scar tissue and also the problems that scar tissue could solve. So even if my endometriosis has been treated, hasn't come back, but the scar tissue has been my biggest issue. But it has improved with the surgery. Another thing I just recently had another surgery. I had a complication that was unexpected in surgery, which for whatever reason meant that they couldn't put the Gore-Tex in. So I'm actually nervous now because I wish, although again, nobody wants to have surgery, but I actually wish they could have put the Gore-Tex in so that I could have that other surgery to remove it because I know the problems the scar tissue could cause. But luckily they could do all these other things that would help prevent the scar tissue. I'm basically saying that it's worth it to have those extra means taken. So, phase 3. Phase 3, I think it was just an addition of something called this Co-Seal surgical sealant. The way that it was explained to me is that it's basically a medicine that they spray to make everything slippery. I know it's crazy, but it's genius that they spray this stuff all over the insides of your body so that the scar tissue can't stick. It's pretty cool. I want to show y'all, if you're more of a visual person, I don't know if you can see this, just these are the conclusions of the surgery in graph form. So anyway, back to it. Something he adds at the conclusion. He had the opportunity to go back and view the pelvis in a small group of patients that were in the phase 2 and phase 3 sections of the research, 1 to 2 years later. And in each case, no adhesions were found to form. So basically it stayed that way. Because again, most of the adhesions form within that first crucial 10-day period. These patients continued to be good over a period of time. So there you have it. Again, as someone who's experienced these surgeries, I've definitely noticed a huge difference between this type of treatment and a mainstream gynecology treatment. You don't find this type of anti-adhesion techniques anywhere else but with NaPro surgeons. So if you are one of these people with endometriosis or some other type of disease that affects you in your pelvis and you want to find one of these doctors, please go to www.fertilitycare.org Or you can email me with questions at takingbacktheterms@gmail.com, or you can private message me on Facebook. I'm also on Instagram. You won't regret it. All the doctors that I know that are NaPro are very easy to work with, and they really, really care about this stuff. They'll be happy to sit and talk with you if that's all you're looking for at first. So if that is you, I wish you the best, and I will talk to you soon.